Question 1. In a context of fetal imaging during the first trimester, sonographer Isa Patel is conducting a transabdominal scan to assess viability. The patient expresses concern about ultrasound exposure to the embryo. Isa Patel assures her that sonography is non-ionizing, but keeps the Doppler application on for over 8 minutes to visualize cardiac activity with audio. What would be the most appropriate critique of Isa Patel's action based on professional guidelines? A. Isa Patel's use of Doppler is justified since it confirms fetal viability clearly. B. The prolonged Doppler use is acceptable as long as the patient is informed and consents. C. Isa Patel should have limited Doppler exposure due to thermal index concerns in early pregnancy. D. There are no restrictions on Doppler duration in first trimester imaging. Answer. Correct answer. C. Explanation. According to the American Institute of Ultrasound in Medicine and Utter-Line Safety Guidelines, the ARRT, as low as reasonably achievable, principle must always be observed, particularly during first trimester imaging. Use of spectral Doppler or color Doppler in the first trimester is discouraged unless medically necessary due to the increased thermal effects of Doppler and the sensitive developmental stage of embryo. The thermal index TI should remain below 1.0 and Doppler duration should be minimized. Option C aligns with these principles. Option A and B fail to consider bioeffect risks, and D is factually incorrect. Question 2. Through careful analysis of a renal Doppler study, sonographer Isa Castillo notes an increased resistive index RI of 0.85 bilaterally. What could be the most likely underlying pathology contributing to this Doppler finding? A. Renal artery stenosis. B. Intrarenal obstruction or parenchymal disease. C. Normal finding in elderly patients. D. Portal hypertension affecting renal perfusion. Answer. Correct answer. B. Explanation. RI 0.8 typically suggests intrarenal vascular resistance, commonly associated with medical renal disease such as acute tubular necrosis, glomerulonephritis, or chronic parenchymal damage, while renal artery stenosis A affects the main renal artery waveform. It often shows a tardive parvus waveform distally, not a high RI throughout. Option C is an oversimplification, and portal hypertension. D doesn't significantly affect intrarenal RI. The use of RI resistive index is valuable, non-invasive tool for assessing renal parenchymal health and is standard in sonography interpretation protocols. Question 3. Based on the information, Ms. Daniels, a new sonographer, is scanning Isa Ahmed, who recently underwent a complex liver transplant. Isa Ahmed is anxious and asks repeatedly whether the new liver is working properly. Ms. Daniels explains she cannot give a diagnosis but assures that images will be promptly reviewed by the radiologist. Isa Ahmed seems unsatisfied and becomes increasingly agitated. What is the most appropriate communication strategy? A. Reiterate that only the physician can provide diagnostic information and proceed with the scan. B. Empathize with Isa Ahmed's concerns and offer to page the radiologist for further discussion. C. Ignore further questions to avoid giving incorrect medical advice. D. Show the patient the sonographic images and point out normal anatomy. Answer. Correct answer. B. Explanation. Effective communication per UT's Code of Ethics and Patient Care Standards involves both empathy and clarity. While sonographers cannot give medical diagnosis, they are ethically responsible to acknowledge patient concerns and, when appropriate, facilitate further medical discussion. Option B provides professional and compassionate solution. Option A lacks empathy. Option C violates patient interaction principles, and D risks misleading or misinterpreting imaging. Question 4. In an effort to evaluate a superficial thyroid nodule in a slim adult, which transducer characteristics would offer the best resolution and detail? A. Curved linear array transducer 3 5 MHz. B. Phased array transducer 2 4 MHz. C. High frequency linear transducer 1015 MHz. D. Endocavitary probe 6 8 MHz. Answer. Correct answer. C. Explanation. Superficial structures such as the thyroid require high-frequency imaging 1015 MHz to achieve optimal axial and lateral resolution. Linear transducers are best suited due to their flat footprint and high-frequency capability. Options A and B are suited for deeper structures like the abdomen or heart, while D is specialized for intracavitary imaging. The selection of transducers should consider both frequency and target depth, as outlined in ARRT Sonography Instrumentation Guidelines. Question 5. When analyzing a pelvic scan of MS, Olivia, a 35-year-old with dysmenorrhea and infertility, sonographer Green identifies a heterogeneous, poorly defined area in the posterior uterine wall and small bilateral cysts in the ovaries. What is the most consistent diagnosis based on the sonographic findings? A. Adenomyosis with associated endometriomas. B. Uterine fibroids with ovarian torsion. C. Polycystic ovary syndrome, PCOS. D. Simple cysts and focal myometrial contractions. Answer. Correct answer. A. Explanation. Adenomyosis typically presents as heterogeneous myometrium, posterior wall thickening, and ill-defined echo texture. Associated endometriomas, chocolate cysts, may be present with endometriosis. This correlates with infertility and dysmenorrhea. Classic symptoms. Fibroids, B, are more defined and torsion would cause pain. PCOS, C, shows a string of pearls pattern and is not typically painful. Myoma. Contractions, D, are transient and resolve during scanning. AM guidelines and references on female pelvic pathology support this differential. Question 6. Considering the evidence, what is the most appropriate infection control protocol during an ultrasound-guided transrectal prostate biopsy? A. Use a standard probe cover with non-sterile gel. B. Employ a sterile technique with sterile gel and probe cover. C. Clean the transducer with alcohol wipes post-procedure. D. Use a non-sterile barrier and sterilize only after procedure. Answer. Correct answer. B. Explanation. Invasive procedures, including transrectal biopsy, require full sterile technique, PCDC guidelines, and Intersocietal Accreditation Commission IAC standards. Sterile probe covers, sterile gel, and transducer disinfection with high-level disinfectants e.g. glutaraldehyde post-procedure are mandatory. Alcohol wipes, C, are insufficient for high-risk exposure. Non-sterile gel A, D, risks cross-contamination. These are critical points in infection control competencies. Question 7. The growing trend in musculoskeletal injuries among sonographers has prompted new guidelines. What is one key ergonomic practice to reduce repetitive strain injuries during prolonged scanning? A. Holding the transducer with a tight grip for better control. B. Twisting the torso to follow the monitor direction. C. Adjusting bed and chair height to maintain neutral wrist position. D. Leaning into the patient for better pressure control. Answer. Correct answer. C. Explanation. Ergonomic best practices as recommended by the Society of Diagnostic Medical Sonography (SDMS) and Occupational Safety and Health Administration (OSHA) emphasize neutral wrist alignment, minimizing shoulder abduction, and adjustable equipment positioning. Tight grips and poor posture (BD) lead to cumulative trauma disorder. EDS. Proper ergonomics are integral to the UT's safety expectations. Question 8. The relationship between pulsed wave and continuous wave Doppler can be best described by which key limitation of pulsed wave Doppler? A. Inability to measure high velocity flow without aliasing. B. Lack of directional information. C. Requirement of constant insonation without pauses. D. Overestimation of low flow velocities. Answer. Correct answer A. Explanation. Pulse-wave EW Doppler is limited by the Nyquist limit, which when exceeded causes aliasing. This makes high-velocity flows, such as in stenosis, difficult to measure accurately. Continuous W Doppler overcomes this but lacks range resolution. Directional info B is provided by both. Option C relates to EW. D is incorrect regarding Doppler mechanics. Understanding Doppler physics is crucial in the sonography physics domain. Question 9. To illustrate this point, Mr. Davis undergoes a scrotal ultrasound due to swelling. Sonographer MS Lopez detects an anechoic lesion with posterior enhancement and no internal vascularity. What is the most likely diagnosis? A. Testicular carcinoma. B. Hydrocele. C. Varicocele. D. Epididymitis. Answer. Correct answer. B. Explanation. An anechoic lesion with posterior enhancement, especially in the tunica vaginalis, suggests hydrocele testicular cancer. A shows solid, heterogeneous mass with vascularity. Varicocele seat shows serpiginous compressible veins. Epididymitis. D. Involves hyperemia and thickening. Correct identification of scrotal pathology is covered under small parts imaging competencies. Question 10. Within the framework of digital imaging and ultrasound, which of the following best describes the function of a PACS system? A. Enhancing image resolution through real-time filtering. B. Facilitating secure image storage, retrieval, and communication. C. Adjusting Doppler waveform sensitivity. D. Providing automated measurements of anatomical structures. Answer. Correct answer. B. Explanation. PACS picture archiving and communication system is a secure network digital system used for storing, retrieving, distributing, and presenting imaging studies. It supports DICOM standards and enables radiologists access across facilities. Image filtering, A. Doppler settings, C. And measurement tools, D. Are machine-level functions, not PACS functionalities. PACS integration is fundamental in digital workflow protocols. Question 11. From the perspective of ensuring optimal imaging in cases of challenging abdominal assessments, consider the following scenario. Esther Rivera, a middle-aged patient with a body habitus known to complicate standard imaging, presents with right upper quadrant pain. Sonographer MS. Lee is tasked with performing a hepatic ultrasound to evaluate possible cholelithiasis and inflammation. Given the patient's obesity, the standard approach might result in poor image quality. MS. Lee needs to decide how to adjust patient positioning and transducer selection. She considers different approaches, such as altering the patient's supine position, utilizing varied transducer frequencies, and repositioning the transducer relative to the liver's location. What is the most effective strategy for optimizing the ultrasound examination in this context? A. Maintain the patient in the standard supine position with low-frequency curvilinear transducer. B. Use high-frequency linear transducer in the conventional position. C. Adjust the patient to slightly lateral decubitus position and employ curvilinear transducer with moderate frequency setting. D. Ask the patient to hold deep breath and use the same supine position with curvilinear transducer. Answer. Correct answer. C. Explanation. For patients with challenging body habitus, studies and AM guidelines recommend optimizing both patient positioning and transducer selection to maximize image quality. A slightly lateral decubitus position can shift abdominal contents, providing better acoustic windows for the liver. A curvilinear transducer with a moderate frequency, typically 3-5 MHz, balances penetration and resolution, which is for imaging deeper structures in patients with obesity. Option A may result in suboptimal images because the standard supine position might not provide the needed acoustic window. Option B is less effective because high-frequency probes have limited penetration. Option D uses breath holding, which can sometimes help but does not address the fundamental challenge of body habitus. This approach aligns with best practices in ultrasound imaging as recommended by ARRT and professional bodies. Question 12. With respect to effective ultrasound diagnostics, consider the scenario where Esther Thompson, a 58-year-old patient, is referred for an abdominal ultrasound to investigate unexplained weight loss and vague abdominal discomfort. Sonographer MS. Kim has limited clinical information from the referral note and must conduct a thorough interview to uncover pertinent details such as previous surgeries, family history of cancer, and recent lab abnormalities. This information could crucially influence both the imaging protocol and subsequent diagnostic decision-making. Which of the following approaches best represents an effective method for gathering relevant patient history? A. Limit questions to the immediate reason for referral to avoid patient discomfort. B. Primarily rely on the written referral and avoid expanding the questioning to save time. C. Conduct a comprehensive pre-scan interview including past surgical history, family cancer history, and recent laboratory results while ensuring patient comfort and confidentiality. D. Focus only on lifestyle habits and ignore the patient's personal history. Answer. Correct answer. C. Explanation. The thorough pre-scan interview is vital for tailoring the imaging protocol and increasing diagnostic accuracy. Our guidelines stress that gathering all relevant clinical information, from previous surgeries to family history of cancer and recent lab findings, Enhances the understanding of potential underlying pathology. Option A and B neglect critical aspects that affect imaging quality and diagnostic planning. Option D overlooks essential history elements and may lead to incomplete evaluation. Conducting detailed history aligns with best practices for patient-centered care and ensures compliance with both ethical standards and protocols. Question 13. When analyzing an emergency scenario in the ultrasound suite, imagine Mr. Johnson, a patient undergoing an abdominal ultrasound, suddenly experiences severe chest pain and shortness of breath. Sonographer MS. Carter immediately recognizes that these may be signs of a potential cardiac emergency. She must decide on the most appropriate immediate course of action while ensuring the patient's safety and minimizing delays in emergency response. What the following measures should she take immediately? A. Stop the scan, activate the emergency code, and call the emergency response team while monitoring the patient's vital signs. B. Continue with the imaging to finish the exam, as the findings could help diagnose the patient's condition. C. Ask the patient to change position in hopes of alleviating the pain while waiting for further instructions from physician. D. Immediately call colleague to take over the scan without informing the emergency services. Answer. Correct answer. Explanation. In any potential emergency, especially when there are signs of a cardiac event, the priority is immediate patient care. And hospital emergency protocols clearly state that the sonographer should halt any routine procedures, promptly activate the emergency response system, and monitor the patient continuously. Options B and C dangerously delay intervention by focusing on completing the exam or repositioning the patient. Option D fails to ensure prompt emergency care. Acting swiftly and following the standardized emergency response protocols is crucial to safeguarding patient well-being and demonstrates adherence to critical care guidelines in ultrasound practice. Question 14. According to recent studies, MS. Freeman is preparing to perform a contrast-enhanced ultrasound CUS for a 45-year-old patient with a suspicious liver lesion. Prior to the administration of the contrast agent MS, Freeman reviews the patient's allergy history and renal function tests, as well as verifies the informed consent. She must also ensure that the contrast media is handled following proper safety guidelines. Which of the protocols is most critical in ensuring safety during contrast media administration in ultrasound? A. Using predetermined dose of contrast media irrespective of patient size. B. Implementing strict aseptic technique during contrast media preparation, checking patient allergies and confirming renal function to minimize any adverse reactions. C. Skipping the informed consent process if the patient has undergone similar procedures in the past. D. Administering the contrast without dedicated to save time during emergencies. Answer. Correct answer. B. Explanation. Patient safety is paramount during contrast-enhanced procedures. The guidelines and related contrast media protocols emphasize the necessity of verifying the patient's allergy history, renal function, and ensuring that aseptic techniques are rigorously observed during preparation and administration of the contrast agent. Option A overlooks individual patient factors. Option C compromises the ethical requirement for informed consent. Option D neglects proper administration routes necessary for safe contrast delivery. Thus, option B best meets the established safety protocols and guidelines essential for maintaining high-quality sonography practice. Question 15. When considering the principles of sound wave propagation in an ultrasound exam, Mr. Chang is evaluating the interaction between ultrasound waves and different tissues. He must understand how acoustic impedance mismatches between tissues can lead to reflection, refraction, and attenuation of sound waves. In a scenario where the ultrasound beam passes from soft tissue into a fluid collection, which phenomenon is most likely to occur due to the significant difference in acoustic impedance and a total internal reflection resulting in a dark artifact. B. An increase in image resolution due to enhanced wave focusing. C. High reflection with minimal attenuation, resulting in strong echoes at the fluid interface. D. Complete absorption of sound waves with no echo generation. Answer. Correct answer. C. Explanation. The theory of acoustic impedance is fundamental in ultrasound imaging when the ultrasound beam encounters a boundary with a large difference in acoustic impedance, such as soft tissue transitioning to fluid collection. There is high degree of reflection at the interface, which results in strong echoes. The fluid itself tends to allow for minimal attenuation, making the boundary clear. Option A does not accurately describe the behavior at such interfaces. Option B misinterprets the physics involved. Increased resolution is not achieved by acoustic impedance mismatch. Option D is contrary to the principles of reflection and attenuation, as complete absorption does not occur. This reflects the core concepts in ultrasound physics that are critical for optimizing image quality and diagnostic accuracy. Question 16. Based on the information MS, Ortiz is reviewing an ultrasound image of the liver and notices an unusual linear, repetitive pattern deep in the field. This artifact is suspected to be a mirror image artifact caused by strong reflectors like the diaphragm. What should be recognized as the most likely explanation for such an artifact, and how should it be addressed during the scan? A rare equipment malfunction that necessitates immediate technical service. B. A deliberate image enhancement setting that should be maintained to improve contrast resolution. C. A normal finding in all liver scans and should be ignored. D. An artifact produced by the reflection of the ultrasound beam from a strong reflector such as the diaphragm, which can be minimized by adjusting the transducer angle or patient position. Answer. Correct answer. D. Explanation. Mirror image artifacts occur when ultrasound beams are reflected off a strong reflector, e.g., the diaphragm, duplicating structures in a reversed location. This is a known phenomenon in ultrasound imaging. Adjusting the transducer angle or repositioning the patient can usually minimize or eliminate the artifact. Option A incorrectly assumes an equipment problem. Option B misinterprets the artifact as beneficial. Option C mistakenly dismisses an important artifact that can lead to misdiagnosis if misunderstood. Recognizing and correcting for such artifacts is essential for accurate interpretation as recommended by our image optimization guidelines. Question 17. In light of recent developments in ultrasound technology, Mr. Patel, a lead sonographer, is responsible for quality assurance. In his imaging department, he must ensure that all ultrasound equipment is properly maintained, calibrated, and functioning at optimal levels to deliver accurate diagnostics and prevent unexpected failures during patient care. Which of the following is considered a critical aspect of a comprehensive ultrasound program? A. Regularly scheduled performance evaluations, including phantom imaging tests, preventive maintenance, and documentation of all service records to meet manufacturer and regulatory guidelines. B. Allowing equipment to run continuously as long as image quality appears visually acceptable. C. Relying solely on routine daily cleaning to maintain image quality without additional technical evaluations. D. Replacing equipment only when significant malfunction is reported by a sonographer during scanning. Answer. Correct answer. A. Explanation. A robust CAR program is crucial in ensuring the reliability and accuracy of ultrasound imaging according to manufacturer recommendations. Regular performance evaluations, such as phantom imaging tests, scheduled preventive maintenance, and meticulous documentation of service records are essential. These measures ensure that the equipment consistently meets diagnostic standards and patient safety requirements. Option B and D can compromise patient care by delaying critical maintenance. Option C neglects the need for technical performance evaluations. Thus, option A aligns best with established quality assurance standards in the field of diagnostic ultrasound. Question 18. Under the assumption that the clarity of an ultrasound image directly affects diagnostic accuracy, Ms. Nguyen is performing a hepatic scan on a patient with suspected liver steatosis. Traditional B-mode imaging has produced suboptimal images due to the patient's body habitus and complex tissue interfaces. Ms. Nguyen considers switching to harmonic imaging to improve overall image quality. What is the rationale behind the use of harmonic imaging in this case? A. Harmonic imaging operates on lower frequencies to achieve deeper tissue penetration. B. It utilizes nonlinear propagation properties of sound waves to enhance image resolution and reduce artifacts, leading to clearer visualization of liver parenchyma. C. It significantly increases the ultrasound power output, making it suitable for all types of examinations. D. Harmonic imaging exclusively optimizes Doppler sensitivity for vascular studies. Answer. Correct answer. B. Explanation. Harmonic imaging capitalizes on the nonlinear propagation of ultrasound waves in tissue, which results in the generation of harmonic frequencies that provide superior spatial resolution and reduced clutter compared with traditional B-mode imaging. This is especially beneficial in patients with challenging body habitus, as the improved contrast and reduced artifacts lead to clearer delineation of structures. Option A is incorrect because harmonic imaging does not operate at low frequencies for penetration purposes. Option C is misleading as increased power output is not the primary purpose of harmonic imaging. Option D incorrectly limits its application solely to Doppler studies. This technique aligns with the ARRT imaging improvement strategies and contributes significantly to diagnostic clarity. Question 19. The primary reason for incorporating elastography into ultrasound imaging is to assess tissue stiffness, which can be an important indicator of various pathologies. In the context of a patient with a suspected thyroid nodule is to Morgan sonography S. Alvarez uses strain elastography as part of the examination. The elastography findings show a high strain ratio indicating a stiffer nodule compared to the surrounding thyroid tissue. Which of the following statements best explains why these findings are significant and what further action should be considered? A. A high strain ratio indicates the nodule is benign and requires no further follow-up. B. A high strain ratio is not clinically significant and can be ignored if B-mode imaging is normal. C. Elastography findings are irrelevant to thyroid nodules as they only assess vascularity. D. A high strain ratio suggests increased tissue stiffness that may be associated with malignancy, warranting a biopsy for definitive diagnosis. Answer. Correct answer. D. Explanation. Elastography is a valuable tool that provides additional diagnostic information by measuring tissue stiffness. In the thyroid, a high strain ratio often correlates with increased stiffness, which has been associated with malignancy, according to guidelines and current research. When elastography findings suggest a stiffer nodule, further diagnostic evaluation, such as fine needle aspiration biopsy, is indicated. For definitive diagnosis, options A, B, and C misrepresent or disregard the clinical significance of elastography findings in thyroid pathology. Hence, option D is the most appropriate next step in management, integrating both imaging findings and evidence-based clinical practice. Question 20. In a modern context of early pregnancy evaluation, MS, Martinez is performing a transvaginal ultrasound on Mrs. Sanders, a 28-year-old patient in her early first trimester. The goal is to accurately date the pregnancy, evaluate the gestational sac, and assess early fetal cardiac activity. MS Martinez faces challenges with patient discomfort and slight uterine motion, which could affect image quality. What is the most effective measure she should take to optimize the quality of the transvaginal scan in this situation? A. Increase the frequency setting of the transducer to enhance tissue penetration. B. Ask the patient to relax and minimize movement without any additional adjustments to the scanning technique. C. Employ steady, gentle probe movements and adjust the probe angle to align with the uterine axis for optimal visualization of the gestational sac and early fetal structures. D. Switch to an abdominal ultrasound approach to avoid discomfort, disregarding the superior resolution provided by transvaginal scanning. Answer. Correct answer. C. Explanation. Transvaginal sonography provides superior resolution in early pregnancy evaluation due to its proximity to pelvic structures. However, optimal results depend on careful technique, employing steady, gentle probe movements and adjusting the probe angle to align with the uterine axis helps minimize artifacts caused by uterine motion and patient discomfort. Option A may compromise resolution if the frequency is set inappropriately for superficial structures. Option B overlooks the need for technical adjustments beyond simply asking the patient to remain still. Option D forsakes the benefits of transvaginal imaging, which are critical in early pregnancy assessments. Thus, option C is the best approach, ensuring both patient comfort and optimal imaging quality as mandated by our transvaginal sonography protocols. Question 21. A logistics company stores perishable goods in cold storage. They apply for property insurance, including coverage for stock. However, the underwriter notices that the refrigeration units are over 20 years old and maintenance records are incomplete. What is the most appropriate underwriting action? A. Decline the risk outright due to equipment age. B. Accept the risk with a condition precedent requiring immediate replacement of refrigeration units. C. Accept the risk with a warranty requiring regular maintenance and inspection reports. D. Accept the risk without special conditions, as this is a common industry risk. Answer. Correct answer. C. Explanation. Underwriters must assess the risk associated with aging machinery, accepting the risk with a warranty for regular maintenance and submission of inspection reports is a reasonable way to manage the risk without rejecting potentially insurable business. This aligns with prudent underwriting practice and mass expectations to ensure reasonable grounds for coverage decisions. Question 22. A printing press applies for property insurance. During risk inspection, it is found that flammable chemicals are stored improperly and near heat sources. What should the underwriter do to mitigate this risk? A. Require relocation of flammable materials and compliance with fire safety standards. B. Add an endorsement to exclude any fire-related claims. C. Accept the risk but increase the premium by 50%. D. Require installation of sprinkler systems only. Answer. Correct answer. A. Explanation. The presence of flammable materials improperly stored increases fire risk significantly. The underwriter should take proactive risk control measures, such as recommending relocation and adherence to fire safety protocols in line with loss prevention principles under commercial underwriting standards. Question 23. A property insurance policy for a textile warehouse includes a condition of average clause. A loss of SGD 600,000 occurs due to a fire. The sum insured was SGD 1,200,000, but the actual value at risk was SGD 2 million. How much will the insurer pay before deductibles? A. SGD 360,000. B. SGD 600,000. C. SGD 720,000. D. SGD 480,000. Answer. Correct answer. A. Explanation. Using the average clause formula, Claywer, sum insured value at risk x LOSCO 1,200,000 2 million x 600 there's AEDD 360,000. This clause ensures the insured is penalized for underinsurance in line with principles of indemnity. Question 24. An underwriter is reviewing a proposal for a commercial property located in an area recently rezoned for high-density residential use. The business is industrial and may soon face relocation. What is the most prudent underwriting approach? A. Decline the risk due to uncertain future use of the property. B. Accept the risk with a short-term policy and add a cancellation clause. C. Accept the risk and charge a standard premium. D. Accept the risk only if the insured agrees not to relocate. Answer. Correct answer. B. Explanation. Rezoning introduces uncertainty regarding continued use of the property. A short-term policy with cancellation rights provides the underwriter flexibility while still offering coverage in the interim, aligning with mass guidelines for risk control and policyholder fairness. Question 25. A hotel suffers property damage due to a burst pipe. The hotel closes for 3 weeks for repairs. The business interruption policy has a 7-day time excess. How many days of business interruption indemnity will the insured receive? A. 14 days. B. 7 days. C. 21 days. D. None. Answer. Correct answer. A. Explanation. A time excess works like a deductible in days. The policy excludes the first 7 days, so the remaining 14 days are indemnified. This is standard practice in business interruption underwriting, encouraging the insured to manage short-duration losses. Question 26. A manufacturer with a business interruption policy opts for increased cost of working hour coverage only. After a fire, they rent temporary premises and continue partial operations. What is the insurer liable to pay under ICO coverage? A. The full gross profit lost. B. Only the additional costs to minimize interruption. C. The cost of repairing the property. D. Nothing, as only property damage is covered. Answer. Correct answer. B. Explanation. ARRT coverage reimburses additional costs incurred, like renting new premises, to reduce or avoid loss of turnover. It does not cover loss of gross profit. This is governed by standard business interruption insurance clauses. Question 27. An insured fails to disclose a history of multiple small fire incidents during the proposal for a commercial property policy. After significant claim, the insurer discovers this history, which legal principle applies, and what is the likely outcome. A. Contribution. The claim will be split with other insurers. B. Proximate cause. The claim will be assessed based on direct causes. C. Utmost good faith. Insurer may void the policy. D. Indemnity. The insured will still receive partial payment. Answer. Correct answer. C. Explanation. The principle of utmost good faith (uberami fide) applies. Non-disclosure of material facts allows the insurer to avoid the policy ab initio in line with the Insurance Act and common law contract principles. Question 20. An industrial plant's property policy has deductible of SGD 100,000. Covered loss of SGD 95,000 occurs due to machinery breakdown. What is the insurer's liability? A. SGD 95,000. B. SGD 100,000. C. SGD 0. E. SGD 5,000. Answer. Correct answer. C. Explanation. Since the loss is below the deductible, the insurer pays nothing. Deductibles are applied to each and every loss, and losses must exceed the deductible to trigger insurer payment. Question 29. A warehouse owner requests a policy extension to include theft by employees. The underwriter is cautious due to the moral hazard involved. What is the most appropriate underwriting response? A. Reject the extension outright. B. Accept with a higher excess and limit for employee theft. C. Accept without change since it's a common extension. D. Accept but exclude losses not reported within 3 days. Answer. Correct answer. B. Explanation. Theft by employees introduces moral hazard, but the risk can be underwritten with a sublimit and higher excess to control exposure. This follows best practices in commercial crime extensions and managing fraudulent claims. Question 30. A policyholder selects a declaration-linked business interruption policy declaring gross profit monthly. Why is this form of cover advantageous for seasonal businesses? A. It reduces the need for accurate gross profit estimation. B. Ensures fixed maximum indemnity regardless of fluctuation. C. It allows for adjustments based on actual performance. D. It limits claims to the first quarter of the year only. Answer. Correct answer. C. Explanation. Declaration-linked policies allow adjustments based on actual turnover or gross profit, making them ideal for seasonal businesses where fixed declarations may lead to over or underinsurance.